What happens if I miss a dose of amlodipine besylate? Have you ever wondered what to do if you forget to take your amlodipine besylate? This medication is a calcium channel blocker that helps manage hypertension by relaxing blood vessels and lowering blood pressure. Missing a dose can be concerning, but let's break down what you should do next. If you realize you missed a dose, the first step is to take it as soon as you remember. However, if it is less than 12 hours until your next scheduled dose, it is best to skip the missed dose. Continuing with your regular dosing schedule is the way to go. It is important not to take a double dose to make up for the one you missed. Now, you might be wondering how missing a dose affects your blood pressure. When you miss a dose of amlodipine besylate, it can lead to a temporary rise in blood pressure. This happens because the medication's effect decreases without consistent dosing. However, amlodipine besylate has a long half-life, which means it stays in your system for a longer time. This characteristic helps maintain some level of blood pressure control even if you miss a dose. Research shows that after missing 1 or 2 doses, your blood pressure may increase slightly, but it generally remains better controlled compared to some other antihypertensive medications. This means that while it is important to take your medication regularly, missing a dose occasionally may not have a drastic impact. On the other hand, if you frequently miss doses, it can reduce the effectiveness of your treatment. This increases the risk of uncontrolled hypertension, which can lead to serious health issues like heart disease, stroke, or kidney problems. Therefore, sticking to your prescribed regimen is essential for effective management of hypertension. In practical terms, if you miss a dose, remember these key points. Take it as soon as you remember unless it is close to the time for your next dose. Do not double up on doses, and keep an eye out for symptoms like dizziness or increased blood pressure. If you have any concerns or experience significant side effects, reach out to your healthcare provider for guidance. Maintaining consistent blood pressure control through regular dosing of amlodipine besylate is vital for preventing long-term damage caused by hypertension. This includes protecting your heart and blood vessels from complications that can arise from uncontrolled blood pressure.